Segment is sponsored by QC Kinetics. If you're suffering from chronic pain, QC Kinetics can help. Here with more is Tyler Ville. How are you, sir?
Doing well. How are you?
Wonderful. Absolute pleasure to have you with us. Tell us first about what exactly is QC Kinetics.
Yeah, we get that question a lot. So we're a non-surgical regenerative medicine clinic, meaning we specialize in orthopedic issues, arthritis, soft tissue tears, and we try to avoid the typical drugs, steroids, pain meds, NSAIDs, and surgery. So we kind of fit in between all that.
What are some of the symptoms that a patient has before they walk into your office, and some of the times they should have walked in a little bit sooner than they did?
I was going to say, some of them walk in and some of them crawl in, but
Yeah.
no, it's pain more than anything. So any kind of joint pain, soft tissue pain, but a lot of times they call and they say, I can't travel, I can't sleep,
Sure.
I can't get down on the floor with my grandkids, I can't do something. It's a quality of life metric that they're losing, that they want to get back, and they've tried steroids and they've tried pain meds and they want to avoid surgery, and that's where we fit in and offer them that.
Now, what happens though when a person comes into your office, and let's say they're having knee pain, and you take an x-ray, you feel around, what is your treatment a lot of times with this?
Yeah, great question. So we're concierge medicine clinic, and what I mean by
Okay.
that is you're going to spend 30, 45 minutes with me. I'm our director of regenerative medicine. We'll go through a history, an exam. If we need imaging, we'll get imaging. We'll come up with a diagnosis if you don't already have one and figure out exactly what we're going to be addressing. With the most common thing that we see is knee arthritis.
Sure.
It's debilitating. People come in, they want to continue to live life. So typical treatment would last anywhere from 6 to 8 weeks. You're not coming in all that often.
Yeah.
And we're trying to regrow or regenerate cells that tissue in your body that's been damaged over time.
This is a can I say a gentle injection of a type of
It is.
medication?
Yeah, so it's not, there's no downtime, there's no recovery time. Patients come in that day, they drive out on their own volition.
Wow.
They're going to go back to work that day. You were telling me you're a runner, you're going to go back for a jog that afternoon
Yeah.
if you want to. So we try not to make you change too much of your everyday activities.
What sort of success have you seen with this so far?
Tremendous. So we've just opened our 4th clinic in 2 or 3 years of being in existence.
You've been with them for 3 years now. This is a part of a company that you developed.
Yeah, so I'm a co-founder. There's 3 partners. I'm our director for regenerative medicine and focus more on the medical aspect of things. But I always tell people the proof is in the pudding. We wouldn't be expanding like we are if we weren't getting the results that we are. And one of the things I'm most proud of is I think we've tipped the scales. We're more referral based now than we are anything else. So I get more calls from patients saying, hey, can you treat my mother? Can you treat my best friend, my brother, something like that?
Yeah, so you get a patient comes in, they've been having trouble, they don't want to go through surgery. You folks come up with the plan that can help them out.
Yeah.
They're feeling better. About how long does this usually last? And I'm sure it varies with each patient.
It does, and it varies on the condition that we're addressing as well, but I always tell people it's a definitive treatment. And so what I mean by that is it's not like a steroid that you're going to come back and get
Yeah.
every few months or every year or so. This is designed to last years, if not decades, and really push you away from that knife and keep you away from it as long as possible.
Yeah, and when people come in, it's they can vary in age. They don't have to necessarily be somebody in their 60s, 70s, or 80s. They can be somebody that just maybe arthritis has gotten in on them
Sure.
over the years, or they've had injuries, and the manipulation or what they're trying to do to recover from that injury is not working, and they come and talk with you folks.
They do, yeah. So we see anything from late 20s all the way up to I have 4 patients currently in their 90s.
Wow.
And it's quality of life. I have a lot of soft tissue tears like meniscus, rotator cuff,
Sure.
biceps tendon labrum, and then bone-on-bone arthritis is, like I said, the most common thing that walks through my doors.
Yeah, you're preaching to the choir right
Yeah.
now on that one, that's
Sure.
for sure. People get a hold of you. We've got a number that'll be at the bottom of the screen. People that get a hold of you, the steps usually, how long does it take to get an appointment to come in, an examination?
Appointment we usually can get you in pretty quickly within a week or so. You're going to spend about 30 minutes with me. We'll sit down and build a rapport and
Sure.
kind of really get to the crux of what you want. If we go through with treatment at that point, I would bank on another 30, 45 minutes. So most people come in and spend their first consult around an hour or so,
Sure.
and then every other time they come in is around 30 minutes, so not long.
Fantastic.
Yeah.
With the different injections, and I say they're a soft injection, so to speak.
Sure.
Can we say that?
Yeah, absolutely.
About how many average does a person need to get before the results are really starting to show?
Yeah, sure. So depending on what we're treating, most people will be somewhere around 3 or 4 injections.
Oh, okay.
And it's not a lot, and it depends on what type of injection we're going to do. We offer a lot of different treatments and a lot of treatments that are not seen very commonly. It's been a field I've been in for a long time, longer than it probably looks, and something that I'm obviously very passionate about. So we absolutely love it.
Tyler Bell, a pleasure. QC Kinetics. Give these folks a call. They can make you feel a lot better, that's for sure. More Low Country Live coming up in just a moment. Stay with us.